More and more people want to work past age 65. What do you do about Medicare? You are eligible for Medicare at age 65 if you worked and paid into Social Security at least 10 years. So most people have qualified for Medicare Part A to be premium free. I don't call it free because you paid for it. But premium free means you won't pay a premium to have Part A once you decide to take Medicare. So you're going to continue to work, and how large your employer is the deciding factor. The law says if your employer has 20 or more employees, you don't have to take Medicare. You're over here. If you have less than 20 employees, you're self-employed, you work for a small company, you need to take Medicare. Now, you might be on group insurance over here, and you might say, I like my insurance. Or you're on Obamacare, you're on ACA, and you're like, I like my insurance. I don't want Medicare. So you don't take it. Well, you will get a late penalty eventually when you retire and you figure out you should have got Medicare at 65. Those late penalties never end. They will last for your lifetime. You'll pay 10% extra per year for every year that you didn't enroll in Medicare Part B that you were eligible for. So in this scenario, you were over here working for a small company, you turn 65, you're like, I don't want it. I have good group insurance. I'm gonna work 3 more years. In 3 years, you'll find out that you have a 30% penalty, 10% for every year you were late. You'll pay extra 10% on your Medicare Part B and your Medicare Part D every month for the rest of your life. It doesn't go away. There's no magic age where it disappears at 70 or 80 or 90. It's forever. It's a steep penalty that we want you to be sure to try to avoid. Now, if you're working for a company with 20 or more employees on this side, you don't have to take Medicare. Your employer could not force you off the plan, and you're very expensive on your employer's group health plan if you're 65. Believe me, they want you off. They used to force people off. Legally, they can't. Some people are breaking the law. And also, they can't bribe you off by saying, look, I'll give you a $200 bonus if you go off our group plan and just enroll in Medicare. That is also illegal. There's ways to do it legally, but just saying, it's illegal to bribe you or force you off. Now, you might want to get off because you've compared how much you pay to be on your employer health plan. A lot of people don't really look at it. Not how much for you and your spouse, how much just for you are you paying? What is your deductible? You might have a $3,000 deductible. What are your copays? What are your extras? Does it have some great dental? Typically, that's uncommon anymore. So when you compare what you could get through your employer of just doing nothing, staying where you are at 65 and staying on your health plan and getting Medicare, you might decide you do want to get Medicare. If you decide you don't want Medicare, you still want to enroll in Medicare Part A. Because we already said you won't be paying for it in 99% of the cases. It's premium free. You get Medicare Part A. The only warning there is if you're on a high deductible health plan at work and you have a health savings account. If you take Medicare Part A because you're like, everybody said to take it and I don't have to pay for it, so I took it, then you won't be able to have tax benefits in your HSA. You'll lose those benefits, you'll lose the match from your employer, and you'll have tax penalties. So if you don't have an HSA at work, you can take Part A, most people do. And you just continue to work for as long as you want. You don't have to notify the government that you don't want Medicare at 65. There's no paperwork to fill out. Just keep working. Then whenever you do want to retire, and I have people that say, I don't know when I retire. It might be in a year, it might be in a month, it might be tomorrow. I might get out of bed tomorrow and say, I'm not doing it. I respect that. So if tomorrow you get out of bed and you're 65 and 1 month old, 67, 68, 69, at any age, you can sign up for Medicare at that time. And you'll have all the rights that you would have had you retired at 65, meaning you can get a Medicare supplement plan, any plan, from any company in the country, and they can't ask you any health questions. They can't discriminate against you because you might be sick. So those rights you had at 65 get preserved since you were on your employer's health plan to whatever age you want to retire. Now, should you sign up for Medicare Part B if you're going to continue to work on this group health plan? No. In most cases, no. A lot of people do because they're afraid of this late penalty. They've heard about the penalty and they're like, well, better safe than sorry. Well, if you have money to burn, sure. Medicare Part B is going to cost you around $200 a month, and it's not really going to benefit you because your employer's health insurance is going to pay first. It's going to be primary. So Medicare is down here underneath it, And it could pay, like maybe if you got cancer, but in most cases, only your employer health plan is going to be paying your healthcare bills. And having Part B in your pocket is kind of just like wasting an extra $200 a month. So, like I said, if you're very sick and you're going to the doctor for a lot of conditions, there might be a benefit of having Part B. For most people, there's no benefit, and that they don't want to spend that extra almost $200 a month. So delay Part B, again, no penalty for delaying it. Now, if you're on the small plan over here, you have to get A and B. Now, we already said you don't pay for A, but B you have to pay for, and that does come as a shock because people are like, they took money out of my paycheck, 15.3% of my paycheck, every paycheck for my whole life. Most of that went to your Social Security. Only about 4% of it went to Medicare, and that is how you got Medicare Part A free. But you don't have Part B free unless you're very low income. Most people, the vast majority of people, will have to pay for Medicare Part B, and like I said, in this scenario, it'll be around $200 a month. Unfortunately, if you are what the government considers rich, you'll pay more. What is rich? Rich means I, as an individual worker, made around $100,000 2 years ago. I filed on my taxes. Or as a couple, we made around $200,000. Now, what is considered rich does change every year. I have those brackets. It's called the IRMAA on our website. You can go check that out. IRMA. The rich pay more for Medicare B and D. But the vast majority of people are paying the standard premium, like I said, it's around $200. Now, if I'm on a small employer plan, I don't want to be on that plan and Medicare because Medicare is going to pay first. So my employer plan's really not doing anything. Medicare would be primary versus over here in this scenario, I said your group health plan is primary. I know it's confusing. But I have this handy illustrative tool with my hands. So if a small plan under 20 lives, you're going to get off the plan. You're going to get off the plan. And if you're the owner of the business, you're happy to get off of it because you see how expensive a 65-year-old is on that group health plan. You're an astronomically priced member of that group health plan. That lowers the rates on everybody from you jumping off onto Medicare. Everybody else stays on the group plan. You'll go onto Medicare. Now, if you're married, your spouse can't go along with you to Medicare. Your spouse has to also qualify and be at least 65. So if you're going on Medicare in this scenario at 65, but your spouse is only 62, your spouse has to get either have her own work insurance or she'll have to go on ACA Marketplace Obamacare. Yes, we can help her with that as well. Over here, you're on a large group plan and you're like, Medicare's a little bit better than my group plan, but your wife is 62, or your younger spouse is 62. Since Obamacare can cost the average 62-year-old about $600 a month, $7,000 a year, a lot of people will continue to work a couple more years, delay Medicare, just to cover that younger spouse. So that's 3 mistakes I talked about. 1, not taking Medicare when you need it. 2, taking Medicare when you don't really need it. And 3, taking Medicare Part A, not B, because you knew you didn't want to waste that money on B, but taking Part A when you have a health savings account at work, which negates all your tax savings. So those are 3 mistakes to avoid if you're getting ready to retire. Another mistake to avoid is just to assume that your group health plan, since we established you can stay on it, is better than Medicare. You have to do the work. People don't want to do the work. They're like, yeah, I can stay there. I'm just going to stay there. It might be terrible insurance. You don't know. You don't know how good Medicare is. A Medicare supplement, we'll say, this is just a standard female turning 65, Part B, we'll say $200 a month. It's actually less, but we'll say $200. A supplement, $100. Price varies depending on your state, but we'll say a 65-year-old female, $100. So we're at $300 a month. A drug plan, we'll say $50 a month. That's a wide variation there. So you're all in for $350. For $350 a month, you get a Medicare Supplement Plan G. You can go to any doctor, any hospital in the country. Compare that with your work insurance, where typically there's a network. You can go to certain doctors and certain hospitals. And when you do, you pay a copay or a percentage of coinsurance every time you get something done. The Medicare Supplement Plan G, in this scenario, for $350, any doctor, any hospital, yes, the Mayo Clinic in Rochester, yes. And all you have out of pocket in addition to your monthly premium is that annual deductible. For this year, it's under $300. Your work insurance, your deductible might be $3,000. $4,000, $5,000 deductible. So people that fail to compare, they're like, yeah, I'm just going to stay in my work insurance. Or they're happy. They're like, I can stay in my work insurance. I'm going to keep working. So they feel like that's a benefit. And unless you're really sick and you take some very expensive drugs, might be better off on Medicare. You have to do the comparison. We can help you do that comparison. You can book a free appointment with our team, the MedicareFamily.com on our website. Just book your free appointment. You be prepared. Tell us how much it costs for you to be on your insurance, you only. Or if you're at the spouse and the spouse is trying to figure out, should I stay on it? Should I get off? What percentage are you paying as the spouse only? Forget about the worker. What is the deductible? What are the co-pays? Just to see a doctor, a specialist. And are there any extras? It's hard these days to find a health insurance plan that has dental, vision, hearing, all these extras. Everybody's trying to save money. They've been cutting them back every year. They just pare it back a little bit. But you might have a really good plan, in which case we're going to say, woo, stay there. Or you might have a really bad plan, but you're taking a very expensive drug. Entresto, very expensive drug that's much cheaper on your work insurance drug plan than on your Medicare drug plan. Medicare drug benefits are not as good as the plan you might have at work. So even though your plan's not good, your deductible's high, the medications you take might sway us to say, woo, 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 stay there anyway. It's mediocre insurance. The drug benefit makes it worth staying there. So a mistake people make is just being flippant about it. Be like, yeah, they don't want to, I get it. Nobody wants to think about it. They don't want to delve into this. It's not an enjoyable process. We try to make it enjoyable, but I get it. Everybody just wants to just be done with it. That's an expensive way to approach retirement. Healthcare is going to be a huge part of your spending in retirement. So you have to grit your teeth, take the time. We will walk you through it. We will educate you as much or as long as you want about all your options and give you our advice. So another mistake is if you are, say you're self-employed and you're on Obamacare, you're on the ACA, the marketplace, and you have a plan with excellent drug coverage. You're like, I don't want Medicare. Sylvia just said Medicare's drug benefit's not as good. It's not. You want to stay over there. I get it, but you can't. Once you turn 65 and you're eligible for Medicare, you have to go to Medicare. You can't stay on Obamacare. So if you had a subsidy from the government, that subsidy automatically went away. But you could continue they're not kicking you off of it. They're going to let you make that mistake. You have to be proactive, get off of it, and come over to Medicare. That's a common mistake that people make. They forget that Medicare Part B is not free. It has a price. And they're like, well, the price, it's okay. But it's not going up, right? No, that price will go up every year. Medicare Part B is tied to inflation. It goes up almost every year. So does your supplemental insurance price or your group insurance. Everything's going up. We get medical inflation. But a lot of people, for some reason, think Medicare Part B, what they pay for it, won't go up. That is a big mistake to make financially. Peg that's going to go up at least $10 to $15 a year. When you're trying to lay out how much money you need to retire, figure out what Part B would cost for you today. Are you a rich person paying more? Are you the standard person? And then add $10 to $15 a year to get yourself an idea how healthcare is going to look throughout your retirement. The last mistake people make is they just don't do anything. They're like, I'm healthy. I'm retired. I quit my job last month. And I never go. So I didn't do anything because I worked my whole life and I paid in all those taxes. So they just don't do anything. And that might work for you for the rest of your whole life. That would be great, right? But in reality, probably at some point, you're going to need Medicare. You might be very healthy at 65, but at 75, 10 years from now, something happens. You can always get Medicare. So you can come to us. We can tell you how to get enrolled, but you're going to pay a huge penalty because you're 10 years late. So you will pay that huge penalty. And a lot of people at that point are like, I can't afford that. They're like, I'll just get Medicare Advantage because Medicare Advantage might have zero or a very low monthly premium. Well, you can't get Medicare Advantage unless you have government Medicare A and B. And you can't get B without paying the penalty. So there's no way to escape that penalty unless you just don't get Medicare. So the biggest mistake of all that anybody can make in retirement is just saying, I don't want to think about it. I don't want to deal with this. That's the biggest mistake, because eventually you got to pay the piper. And then we try to fix the mistake of you not figuring out what your rights are, what you had to have done or not done at age 65. So if you want our help, it's free. Book your free appointment on our website, themedicarefamily.com. We're independent contractors. You don't pay us. Insurance companies pay us to help you. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.